Early this year, the Trust launched its new 5-year strategy, Our New Journey Together, which builds on what we have achieved as a Trust so far. Our strategy sets out our vision, values and strategic ambitions for the next 5 years and gives us a clear direction as we navigate through the changing NHS landscape. In order to make sure our strategy really makes a difference for our patients and colleagues, we also agreed a strategy delivery plan which sets out the key actions that we want to deliver over the next 5 years. This video shares some of the progress we've made over the first 6 months of our strategy and highlights particular achievements. So why do we need a new strategy? The NHS and our own organisation have all changed significantly in the last few years. In response, we need to revisit our ambitions and reset where we will be focusing our efforts in order to deliver exceptional and personalised care to our patients, build a healthier community across Rotherham in collaboration with our partners, develop brilliant and valued teams with the right skills, and deliver our services in an efficient and sustainable way which provides timely and equitable access to care for our communities. And so, this delivery plan sets out a range of initiatives to be delivered over the 5-year period against each of our 5 themes: patients, Rotherham, our partners, us, and delivery. We now take a look at the progress of some of the 20 actions planned for this year, 2022 to 2023.
So I'm Helen Ledger. I work in the system improvement team across the north regions. That's in the northeastern Yorkshire and the northwest, and all things improvement really across the patch. And one of the roles we have in the team is about helping people and delivering improvement training. So today we're doing measurement and we're doing the quantitative stuff. So it's the data and the numbers. On day 3, we'll be doing more about the qualitative, sort of the patient engagement, some of the surveys, the feedback, the focus groups, collecting the stories and that sort of engagement. And also we do quite a lot around how to engage with stakeholders, but it's like sparking that interest and giving them those tools and techniques that they can then go out and hopefully engage with other people and do lots of lovely improvement and make things better for our patients and staff.
I'm Elaine Jeffers, I'm the Deputy Director of Quality Assurance, and one of my key roles is to develop the quality improvement agenda across the organisation. We've agreed as an organisation that we will use the CUSA methodology as our quality improvement tool, and we're about to recruit a quality improvement lead who will then be able to take this agenda forward. So far, we've actually put 20 individuals from the organisation through cohort 1 of the CUSA training. We have cohort 2 planned for October, November, and cohort 3 planned for March of next year. We've identified 2 individuals who are going to undertake the trainers to start to build the quality improvement faculty across the organisation, and that will happen in October, and hopefully we'll get some more willing individuals from cohorts 2 and 3.
So the public panel actually helped to shape the new strategy right from its earliest format, and what they really stressed was that they wanted more patient engagement, patient carer and public engagement in everything that we do at the Trust. In the new strategy it does say that we want the patient voice at every single meeting. That doesn't mean that patients have to be present, but we want that voice coming through. The public panel is one of the ways that the Trust does that. So it's a group of people that are just interested in improving the Trust as a whole. In terms of the public panel, we hold a monthly meeting, and this is currently online but looking to move to a hybrid format where we're on site as well as online. And then the topics are quite varied, they're set by the public, and then these get fed back to whoever they're involved with.
The Urgent Community Response is a new metric that was introduced by NHS England in spring of this year. The metric is about keeping people in the community and saving admissions and attendances at A&E. The metric means that we try to see our patients within 2 hours in a community setting. The metric will come into play in December of this year, where we're expected to meet a target of around 70%. At the minute, we're currently around 80–85%, so we're on track to meet the target, which we're required to meet.
Hi, I'm Martin Hazelwood. I'm the Estates Energy Performance and Contracts Manager. During the last 2 years, we've entered into a 20-year energy performance contract with our partner Veolia and Carbon Energy Fund. And this will result in pretty much about a 33% reduction in our carbon emissions. We've also been successful in procuring funding from the Public Sector Decarbonisation Scheme, PSTS3, and that will allow us to further augment the good work we've done with the energy performance contract, improving ward heating controls. We're going to put a heat pump in Old Green Oaks building that will decarbonise the gas heating in that area, cavity wall insulation in Loxley, Swale and Derwent blocks of flats. Also during the energy performance contract, we've changed out over 7,500 fluorescent lights for LED lights with smart controls. We've also had a very large investment in insulation in all the plant rooms and service ducts, and we're swapping out 380, I think, new windows, replacing all wooden single glazed windows to reduce carbon emissions, reduce energy and also save some money.
My name's Amanda Markle. I'm Lead Transformation Nurse for Alcohol Services here at TRFT. I'm really proud to celebrate the fact that we've got an optimum treatment site, one of 4 in England. And because of that, we've been able to apply for funding from NHS England, which has allowed us to deliver a community service for patients that are really vulnerable, that just come to hospital and get sent away again and nobody picks them up. And so we're really excited that we're able to do that. And in only 3 months, we're making a massive difference to patients. And they're addressing housing issues, benefits, food issues, college. We've got somebody that's enrolled on a college course that we've known for 6 years and we've never been able to do that. So I'm really proud to showcase this, and I hope that we get refunded and that we can share this experience nationally to show that you can make a difference.
Rotherham Place is a partnership between health and social care organisations. There's 6 key ones, the Rotherham Foundation Trust being one of the main ones within the partnership. And within the workforce enabling group, we've agreed as partners our key priorities and values aligned to the Integrated Care Board. So the values are around being one team, that we're empowered and innovative. And within that, we've had lots of different events with Get Up to Speed with STEM, so that's science, technology, engineering and manufacturing. We've not previously had a voice, the health and social care sector, in these events, and they're all aimed at school children, showcasing our health and healthcare scientist roles. We were able to bring apprenticeships there as well, so great to reach out to over 3,500 school children and introduce them to over the 350 different careers that we've got in the NHS, which they don't know about. They just assume we are doctors and nurses. So these are very important events to reach out to our future workforce. We've had our joint career event in June. It was the first one in Rotherham, getting all our key stakeholders across health and social care together and be able to promote what vacancies, careers, apprenticeships that we can offer across Rotherham. More recently in September, we had an Inspire event where we had our community colleagues attend, NHSP were there. Schools career event we're looking at. We've not done that before in Rotherham, so it'll be our first event. Doncaster currently run it very successfully, so we're working in partnership with them to glean best practice from them and learning.
I think what we're seeing now is a move towards partnership working as a really important way for all organisations. And having a joint chief executive across 2 similar organisations really lowers a lot of the barriers for working with another very similar trust. Also within our local area across South Yorkshire, Rotherham and Barnsley are 2 of the smaller trusts, but by working together with some shared partnership programmes, it gives us a much bigger influence within the acute federation and with the integrated care system. So I really hope that we can turn the advantages of having a joint chief executive into meaningful change for our patients and staff.
So the Trust Behavioural Framework was launched in 2021. It's designed to help us to embed the research around civility and patient safety within the NHS, linked to the National Civility Saves Lives campaign. So research shows us that where there's poor behaviour in the workplace, not only does poor behaviour breed poor behaviour, but it also significantly negatively impacts on patient safety. And to support the behavioural framework, we've also been supporting teams to develop their own team behavioural charters, so to talk together about how they want to be and how they want to behave as a team.
So a month into my role, we did some events. We did about 16, talking to over 150 staff to ask them face to face what they thought made a good day to come to work, what made a bad day, and what must we do as a department, what should we do as a department, and what could we do. From that, we've got an Achieving Excellence plan, which broke down into 5 pillars. One was regarding workforce, one around leadership and engagement, one around pathway redesign, patient experience and ways of working in UECC. These are the simple things that's hopefully heading us towards a better department, nicer to work in, and more staff wanting to come.
So welcome to Rotherham's new command centre. So about 18 months ago, Rotherham NHS Foundation Trust embarked on a digital journey in improving our visibility and improving patient flow. The great success of this new digital command centre was the collaboration that we had with health informatics colleagues, the operation teams and also our clinical teams to make sure that the patient journey was at the forefront of anything that we designed. One of the other key developments as well was trying to have a real-time escalation system so that it fed digitally, that updated and wasn't reliant on a twice daily snapshot that was quite subjective. So one of the key developments that we did with an off-site company was to build our own escalation wheel. We're really successful in terms of over 90% of this is digitally fed through the systems we have working in the hospital, and it's updated every 5 minutes. So it's real-time escalation system. We've also built into this the ability to alert. So not only now can you visually see that, but it alerts you in terms of text messaging, Microsoft Teams, and we're just working on the email functionality to obviously display that as well. For us, we've got lots of things where we want to take this digital journey. And what that means for us as an organisation is that we absolutely keep the patient at the forefront of anything that we are improving.
Over the last 6 months, we've been working with primary care and continue to deploy the Rotherham Health app, which allows patients to look at their appointments and both hospital, primary care and community. We've also continued to deploy something called the Patient Hub, so we're sending out thousands of letters electronically now to enable patients to cancel and rebook their appointments, and looking to further integrate that with the contact centre. And what's really exciting is we're now on something called a pilot programme for NHS Wayfinder. So you'll receive notifications such as appointment reminders. So as well as getting a text message, you'll get a notification. You can log onto the app, you can see the hospital appointment letter and that sort of thing. And you can cancel and rebook in real time without having to call a member of staff.
We cannot achieve these ambitions on our own and can only continue to succeed with the help of our community, our colleagues and our partners. It is a privilege to be part of shaping Rotherham's future and working together to bring our new journey together to reality.